5 days ago, the Western Journal, American citizens being turned away so New York City Hospital can give health care to illegals. Why would that be? Because they'll get government funding. That's why. That's why. That's why they loved the CARES Act for COVID. They loved that. Because that's why everybody was diagnosed with COVID, even if they died in a motorcycle accident. Oh, they died with COVID, so we can get that, what was it? Well, they got 39,000 if they went on an event, but they got, many thousands of dollars if they died with COVID too. It's the same thing here. Because, it is Obama, because Obama is the one pulling the strings here behind Biden, but it's because Biden has offered free health care to them. Yeah. I don't know how anybody can trust these hospitals again. I really don't. What they have gone along with. Because again, it's the same, it's all about the same thing. And here's why it's important. There's more. April 2023, immigrant healthcare workers in the United States. So I had done a video last winter about, I read into the International Nurse Council, which is out of the UN, okay? And they're tied to the Global Nurses United, and that's all tied to the nursing associations here in America. They're all on board with this. I've explained this many times. But I looked into what their obsession was with this migrant, like they want this Nurses Without Borders thing, which they already have Doctors Without Borders, but it's almost like that they're trying to bring it on that. Are they trafficking? Are they complicit in trafficking? But they're calling it travel. And the reason I say this is because when I first got out of nursing school, before I had my first job in psych, I did 1 day in a nursing home. It's hard work. I was a first time nurse, so I lasted 1 day, really, a day and a half. But while I was there, I noticed like everybody was Filipino. They didn't look happy. They seemed to hate me, and they didn't even know me. But they seemed to have this resentment at me, and I couldn't understand why. And then I had learned, I forget from who, because I think I asked about it, like why are they so unhappy? And somebody had told me, because there was few Americans working in there. They said they're here on a work visa. And they had to work there for 2 years. If they quit, they would be deported. They couldn't just quit and go get another job. And the thing that was fishy about it, but I didn't know anything back then about trafficking, was that they all traveled to and from work together. So wherever they stayed together. So based on what I know now about trafficking, all the research I've done into it, that's indentured servitude. They likely were tricked into coming here, had all of their IDs and everything taken from them, put into indentured servitude. It's cheap labor for the nursing homes, which I think is what the hospital's goal is, why they're doing it now. And then they can't say anything to you because this wasn't told to me by one of them. And it would make sense then why they would resent me. They would see all Americans as horrible, because, well, first of all, if they were indentured servitudes, they were doing all that hard work, getting little pay for it. But they had to finish this contract, okay, for the work visa. Yet usually the way trafficking operations work is all of them stay together in one location. So every time a shift came in, because it was mostly nurses that were Filipino, they all came in they all stayed at the same place and all came in together. So, now I realize what that was. It was indentured servitude. They were likely tricked into coming here and just trying to buy out their time, hoping that after the 2 years they would be given citizenship or so that they could go back home. Who knows if they were tricked into coming here. But this is what the hospitals are trying to do. Here's why. And the nursing associations are on board with this. Nearly 2.8 million immigrants were employed as healthcare workers in 2021, accounting for more than 18% of the 15.2 million people in the United States in a healthcare occupation. This was slightly higher than immigrants' share of the overall U.S. civilian workforce. Sorry, my contact lens is bothering me. And the foreign-born were especially overrepresented among certain healthcare occupations, such as physicians and surgeons, 26%, as well as home health aides, 40%. Approximately 1.6 million immigrants were working as doctors, registered nurses, dentists, pharmacists, dental hygienists. So our own healthcare system, not that this surprises me, for 3 weeks, I've been doing travel nursing for 2.5 years, and over 2.5 years, really. And in the last 3 weeks, I can't find anything. The one wants to now force flu vaccine. They've never done that. But the other ones, they end up on hold. Yeah, because they want foreign workers, because it's cheap labor. This spotlight provides a demographic and socioeconomic profile of foreign-born healthcare workers residing in the United States. The data comes primarily from the U.S. Census Bureau's 2021 American Community Survey and Bureau of Labor Statistics. All data refer to civilian employed workers 16 and older. But see here, it says foreign-born and immigrant are used interchangeably and refer to persons with no U.S. citizenship at birth. This population includes naturalized citizens, lawful permanent residents, refugees, and asylum seekers. So that would include everyone coming across the border. So how many of them? Our own healthcare system wants to take jobs away from nurses like me who are Americans. Of course they would. They want to give it to foreign workers, while the American medical and nursing profession has wrote all these papers, because they've been on board with the globalists, to do this. Oh, we need to migrate nurses. And no, you're just helping the hospitals to get cheap labor and screw this country over the same way that Biden is. That's why you supported open borders. Every nurse should be starting to call this shit out. This is why the hospitals cut your staff. It is. They wanted all the nurses to rise up and strike because they want to get rid of nurses. Now, you think those contracts hold, right? I wouldn't be so sure about it. These globalists know what they're doing, okay? This is also the rich, the super rich, your Soros rich can get more rich. They don't care who they have to screw over. And this is how much they're screwing everyone over. While immigrants play a vital role at all levels of healthcare, the Migration Policy Institute estimates that 270,000 immigrants with a college degree in medical and health sciences and services were on the sidelines of the pandemic because of skill underutilization. That is, because they were working in lower skilled jobs, such as registered nurses working as health aides, or were out of work, like immigrants employed in healthcare overall. Most of these underemployed immigrant healthcare professionals are bilingual. Yeah, this is one of the excuses they use, like the nursing profession. We need more people that are bilingual. Yeah, what a joke. The whole healthcare profession is screwing the everyday American over. And what is Congress doing about that? They don't care. They don't care. They don't care if people like me, who are American citizens, okay, and worked hard to become a nurse, yet because all these hospitals merged and all these nursing unions and medical associations and nursing associations got on board with this, they, along with Joe Biden, are screwing people like me out of jobs. Just think about that for a minute. How dare they do that? How dare they do that? And every nurse should be raising, instead of going and striking against your hospital, you're getting screwed over, okay? They want you to strike, because if they decide to cut that contract, believe me, they don't care about that contract. They tell you they have to abide by it. That nursing union is using you to help those CEOs bring in their migrant workers. That's why they supported open borders. So those migrants, those illegal immigrants, could take jobs away from nurses and doctors that are born in this country. I don't know how anybody would ever trust any of these hospital systems or the nursing association ever again.